Let's first, I think, introduce each other. My name is Masha Plosko. I'm from Eurasian Harm Reduction Association. I work with many issues, including women who use drugs and access to services. I'm really happy to see all of you here today. I've been looking forward to this meeting. I would hope someday we'll all meet in person, but for now it's only online. And let's start with Ala, I think, our partners from Eurasian Network of Women Living with AIDS. Ala.
Здравствуйте, коллежанки. Меня зовут Алла Бессонова.
Hello, dear colleagues. My name is Anna Bessonova. I represent Georgian Female AIDS Network, and we deal with issues related to women living with HIV and women injecting drugs and living with HIV. That's it.
And I will go from how I see you on my screen. And the next one is Ivana from HOPS, Macedonia.
Hello from everyone. I'm Ivana Andreevsky. I'm coming from Skopje, from the civil society organization HOPS Healthy Option Project Skopje. And I'm program manager of the sex worker support program at HOPS, which tends to expand to women at social risk. Thank you.
Great, thank you. And the next one is Alena from Moldova.
Здравствуйте, меня зовут Алена, я представляю организацию Союз за справедливость и здоровье, город Бельцы.
Good day, I represent the Union for Equity and Health in Belki. What else? I don't know. I think it's it.
No, as you will be speaking later, then that's it. The next one is Ivana from Juventus.
Hello, everyone. I'm Ivana Kulashevich from Juventus, NGO from Podgorica, Montenegro. I work here as a social worker in drop-in center for people who use drugs, people who provide sex services, and in a prison and with prisoners and ex-prisoners. So I'm happy to be here. Thank you.
Great, thank you. And the next one, Antonina from Ukraine.
Всем добрый день, меня зовут Антонина.
Hello, everyone. My name is Antonina Denisova. I represent an NGO called Club NA. We are located in Kiev, Ukraine, and we work with people living with HIV, people who use drugs, and we are introducing a methodology for a more gender-oriented provision of services. We also work with commercial sex workers. Thank you.
Thank you. The next one, Elena from Croatia. Yelena from Croatia.
Hello to everyone. My name is Jelena Pozaic. I'm working like a project coordinator in institution Zajednica Susret. I'm coming from Croatia. I will tell you more later about our NGO and our work, but we are working with the people who are facing with the addiction and also victims of violence.
Great, thank you. Almina from Armenia, I think.
Да, здравствуйте. Я Армине. Да, я Армине.
Yes, hello. Yeah, my name is Armine. I represent NGO Real People, and I work in the harm reduction program as the monitoring and evaluation specialist. And here is Hasmik. Yes, my name is Hasmik. I am an outreach worker in the harm reduction program.
Great, thank you. The next one, Maria. I think it's only one Maria, so yes, Maria.
Добрый день, меня зовут Мария Годлевская. Сейчас я...
Good day, my name is Maria Godlevska. I'm a free activist now, and I am a member of the Eurasian Female Eats Network. Thank you.
Thank you. Next one, Tatiana.
Здравствуйте, меня зовут Татьяна.
Hello, my name is Tatiana, and currently I represent the UNEST community, and I'm also a representative of an initiative group here.
Thank you. Oksana.
Здравствуйте всем, меня зовут Оксана.
Hello, everyone. My name is Oksana. I represent the Union for Equity and Health. Our organization works at the national level for advocacy, lobbying for legislative change. We provide support in changing the attitude to drug users and making changes to the punitive legislation against drug users. And we also provide support to female drug users and female people living with HIV. And my colleague will be sharing more about our work later on. Thank you.
Thank you. Ekaterina.
Здравствуйте, меня зовут Екатерина, я из Эстонии.
Hello, my name is Ekaterina. I'm from Estonia. I work in harm reduction together with Masha, and I am the peer consultant.
Okay. Елена. Лена.
Доброе утро, меня зовут
Good morning. My name is Elena Antonova. I represent the Estonian community of people using drugs. Also, I am a member of the board of the Eurasian Female AIDS Network, and I'm a country representative in this organization.
Thank you. Екатерина.
Hello, my name is Ekaterina. I work in a harm reduction organization in Estonia. Thank you. Hello, my name is Christina. I also am a peer consultant in the local harm reduction NGO. Thank you.
Thank you. Medea.
Hello, everyone. So glad to be with you, missed you all. So I represent Georgian Union of People Living with HIV. I'm the program manager, but at the same time, I am SRHR Direction Supervisor for Women Fund Georgia, and there is a new organization established in Georgia that are kind of union of women living with HIV. We exist, and I'm the board member of the organization. Thank you.
Thank you. As people are coming and going, I'm a bit lost now who already introduced themselves or not. Nina.
Good morning. I'm Nina from AIDS Action Europe, and actually two of our core thematic areas. One is sexual reproductive health and rights, and the other one is harm reduction.
Thank you. Okay. Christina.
Здравствуйте, меня зовут Кристина.
Hello, my name is Christina. I'm from Kazakhstan, from Almaty, public foundation called Revanche. And Yelena Belakon asked me to present here instead of her. I work as a peer counselor for the Revanche NGO. Can you hear me, actually?
Yes.
Ну, сейчас так представление просто меня выбивало, я не совсем.
Because I had some problems with connecting to the internet. I was kicked out of Zoom. So actually, just to make it clear for me, are we still having the round of introductions?
Yes, it was still a round of introductions.
Все.
Thank you. If I missed someone, please introduce yourself because like people are coming and going and I'm now lost in all the screens. Елена, yes.
Да, добрый день.
Yes, good day. My name is Yelena Shostina. I'm from Russia. I am member of the European Harm Reduction Network and the European Female AIDS Network. I'm a representative of the community of people using drugs, people using with HIV, and but here I represent myself actually because I do take interest in female and women's problems. Thank you.
Thank you. And one other person from Neva from Slovenia, she will join us a bit later and tell about their work. So let's begin then our meeting. Again, I'm very happy to see you all, and this meeting is happening while there's going the campaign 16 days of activism against violence, and I really like the part about activism. So today I want us to talk not only about dreadful statistics in our region and the lack of access to services and all the problems that we all know, but share actually inspiring examples from the region, because I know all of you who are here today also work on those issues and have interesting projects to share. And now I'm giving word to Alla.
Да, спасибо большое.
Yes, thank you. Thanks to all the women who have joined us online today. You're all so beautiful, and it's always great coming together, meeting each other, and sharing about what we can what we can do. And actually, we have a lot of topics on the agenda for today that we're going to discuss. And when we speak about support to women using drugs who face the dual stigma because of the criminalizing drug use laws in the region, actually, it's something that is very important. It is also very important to hear the organizations who provide rehabilitation services to women with children, and also to hear from peer support groups providing support to women with children. Thank you.
Thank you. And if you have any questions to the presenters, or you will have something to add or to share what you have, but you're not on the list of speakers, please write it in the chat group or raise your hand and we'll give a voice to you as well. I want this meeting not to be a formal presentation and listening to each other, but more of a forum, a discussion and sharing of experience. And as Medea is struggling with the charger, I'm giving the first word to Medea from Georgia to tell us what they have in Georgia.
Thank you so much. I'm at the university. I came earlier and somehow figured out that there is no electricity, but whatever. So how used to that. So thank you, first of all. I wanted to share so many things, but try to concentrate myself on the positive side, what has been something that actually was a, one brick put in terms of achieving our joint aims. I would say that due to the support of number of the regional organizations, including Eurasian Harm Reduction Association, EVNA, there has been more research is going on recently And whenever we speak like evidence-based advocacy, we've been having more data in hand. And that was something very positive thing happening. Also taking into consideration that number of the researches, for instance, regarding accessibility to the services or cross-cutting services like accessibility or sexual and reproductive health and justice issues, like in relations with the violence, all those, the quantitative and qualitative researches, and there has been a number of them, has been done with the community members themselves. So that's something that I was really proud, and the team was really proud about. And I think that its constant support make those women visible in some of the spaces that were not that much occupied by them. And now there is the alternate representative in CCM for women living with HIV, also like standing for women using substances and in sex work. So I think that was a very good step. Another thing that I would like to share to you is that this actually, I think that you were very well aware of the process that was going in Georgia, and not only in Georgia, the similar activities had been done in Ukraine and Kyrgyzstan, at least what I know. There was women initiating new goals of safety, and those was pretty much the interventions that helped women living with HIV using substances and sex work to empower them to build the spaces where they could stand up against and protect themselves against the intimate partner violence. That initiative started back in 2018, but what I really found an interesting outcome of it, not only there are the groups who actually continue doing it and integrating these initiatives and number of the projects they are in, they came out with establishing the new organization. And these are fully women-led. I mean, with the Georgian Union of People Living with HIV, we're rather than, that are, definitely the community, but the expert groups, which, while this new organization is purely led by women, and by women, I mean all the women that we work and support with. And finally, the new initiative that has been done recently was to create the safe self-support spaces. Also, there is the very good initiative working on the module for integration of the clubbing, kind of the safe rave and SRHR. That's the new attempt they are doing. And I'm also involved, I'm part of it. And at the same time, what I really liked that starting getting the small grants outside of Global Fund scope. And you understand how difficult it is in this intersectional stigmatized surrounding in Georgia, but I think this consistency and the joint support of different organizations towards that groups, actually, somehow it ended up with us having more faces, new faces, old ones and the new faces, and maybe having their better voicing their problems in CCM. That's in a nutshell. If there would be questions, I would be glad to contribute.
Yeah, thank you, Medea. I also wanted you to share how you got the funding for that abortion services that we talked about for the magazine that Eurasian Harm Reduction made last year.
So abortion is a very painful topic. I skipped it, but that's something might be very contributive. Back then, there had been two different organizations. One is Safe Abortion Action Fund, another is Women Fund Georgia, also Open Society Fund. They had this joint initiative of supporting the referral to abortion. And we had specifically informed sessions for people using substances, because medical abortion accessibility is a bit of a different than the group. And we've managed to create this friendly service provider referral. But now we are quite suffering. I didn't want to mention it, but this is something to know. Recently, it was the end of October, there has been the regulatory changes regarding abortion service provision in Georgia. What they did, actually, I mean, some small group within the Ministry of Health, without any consultancy with the expert groups, not only civil society, rather their own experts, there is a specific group called Maternal Health Expertise Group, and we have our fund-based service providers there that provide abortion services, including medical abortion. Without having any consultancies, they added mandatory consultancy for a woman before the decision on abortion is made. They did it like not only with the gynecologist that was there, but including the social worker and the psychologist. And you understand, having it mandatory is already against clients or patients' autonomy. If that's optional, and if you would like to be supported by the discipline representative, that's different, but they made it mandatory. And if taken the situation when these people are well aware of their obligations and don't interfere with decision making at all, there is physically lack of the staff. So I assume there would be a problem for the many clinics. So, and this change will be pushed into practice since January. So we are not having the good, expectations how it goes. Another thing, what they did, they made the regulatory changes where the medical abortion at what stage can be accessed. And now there is the limitation that after 7th week, even medical abortion should be provided in multifunctional clinics. And you know that there is almost none in rural areas. You can find those types of the clinics only in big cities. So geographical accessibility, limitations that might cause to some not having enough services, and even if including this proper, well-trained like social worker and psychologist, it definitely increases the price of the service. So yeah, we were like thinking of working on different level, making those referral gynecologists and the referral services more sensitive towards individual needs. But now we have a huge backlash. We're starting with even dealing with physical accessibility and availability and affordability. Yeah, positive things, but not that positive in the end. But we still count on our supporters, and I will update you about how it will be proceeded since January.
Great, thank you. I also, in the chat, I shared the link to the FS page about women who use drugs. There is the magazine there. There's a lot of resources that we mentioned here today, that will be mentioned here today. And the next word I would like to give to Antonina, because as Medea said, this project, WINGS project, Women for Safety, was also implemented in Ukraine, and Antonina's organization, as far as I know, was also part of it.
Да, добрый день еще раз. Я хочу сегодня
Yes, good morning again. So I would like to tell about the short-term intervention WINGS. So it is WINGS mean this abbreviation is about women initiating new goals in safety. So this initiative helps women to plan their strategies of safety and security based on their individual conditions where they are, to strengthen their social support network and have access to different services. So in Ukraine, this methodology was adapted several times. First of all, it was adapted to working with the women living with HIV. Also, there was an adaptation to working with sex workers. And the last adaptation and revision was to adapt to the conditions of war in Ukraine. So in 6 years, we covered 16 regions and 4 key populations, and we have also 4 donors who support these projects. And in fact, as opposed to other methodologies which are aimed at countering violence, this approach wings allow women to make their own choice and define what they would like to achieve. So this approach is not aimed at women kind of live in the situation of violence. First of all, it starts with a survey, a questionnaire, so that the woman would understand their own risks, so that they would set their own goals, and so that a support system would be built based on the resources that are available and the resources where we can refer them to. For instance, within different adaptations of this approach, we also offer gender-sensitive services, starting with testing and reimbursement of medical costs. Also, it can be emergency contraception, pregnancy tests, providing contraception means, hygiene items, or vouchers for food products if women are in difficult economic situations, if they are economically dependent on their partner or other people, providing also baby food, diapers, and referral of those women to the specialists who can provide the services those women need. And in fact, in Ukraine, this approach showed very good results. I can read out some feedback from the clients. Earlier, I was not talking about violence because I was afraid that I will be judged, because people judge women who use drugs. They say that it is our own fault. If we didn't use drugs, we would not be beaten. Or, I did not know that when I'm locked in an apartment, I did not know that it is violence. Also, I did not know about my rights. So I want to say that an important part of our projects is informing people, raising their awareness. So the first step to resolve the problem is to actually see the problem, learn about your rights. And in our latest project, which started in October, and we plan to cover 16 regions with it. An important part of it is advocacy. So we have 32 facilitators from 16 regions, and they will learn this methodology, go through it, and we plan to cover 3,000 women in Ukraine in the upcoming years. And we plan to organize roundtable discussions and conversations with the authorities, so that this approach wings would be covered from the state budget, and so that we could scale up this approach across the country, because we do see the results, and this approach, it really meets the needs of women. It helps to improve their safety in different situations, because this methodology, it can be adapted and adjusted to different categories of women. And currently, 2,500 women went through this program. We were able to to build this community of women against violence. And also what we see after these sessions, women, they start believing in themselves. So it has this positive effect that they are empowered, they are ready to act, they are ready to bring the change in the community, share their knowledge with other women, and it builds their capacity, their self-reliance, and their readiness to change. Yep. If you have any questions, I can answer them. I can tell more about the different stages of our work or of this methodology. Thank you.
Thank you, Antonina. If If anyone have questions, please raise your hands to any of the previous speakers. Okay, if no, we will continue. And as Medea mentioned, the accessibility of abortion services and actually gynecological services, it made me think about North Macedonia, where I think the first time I saw the gynecological van, and I was really impressed by this service. And I will invite Ivana to tell us more about this. Ivana?
Yes, I'm here.
Okay.
Thank you for the opportunity to participate to this event. Namely, HOPES is an organization that has been working with the people who use drugs and sex workers since 1999. And with the availability of the funds from the Global Fund of the fight HIV/AIDS and malaria until 2017, we were able to provide women who use drugs and sex workers with free gynecologist examination and private gynecologist, and with who we cooperating along years. It was a gynecologist who know a lot about the needs of those two target groups, and he was trained to work with them also. Unfortunately, with the departure of the Global Fund, the state, that means the Ministry of the Health, took over the HIV prevention programs, but with drastically reduced funds, and we were forced to cut some of the existing services. It means we moved the women to visit their own gynecologist and to pay about it if they do not have health insurance, and to do so in a related association of citizens that provide the services of gynecologist. After 5 years of going of the Global Fund in 2021 in a project with MAGO, that means Macedonian Association of Gynecologists and Obstetrician, with cooperation with UN Women, we started collaborated, and managed to provide them with free gynecologist services with medical van, and working with top doctors from the gynecologist clinic. Almost every month we organized the van of the Day Center for Women and Social Risk. We inform interested parties and examination that we created out of 3 to maximum of 10 women in one shift. A medical cabinet was also provided to those who need it. From this cooperation with MAGO was born the idea of visiting the van in women's prisons in Skopje, and with our help, MAGO enabled examination of 40 female prisoners, including users of our services. It was a really successful job, because in the prisoners in Skopje, there is...
Ivana, you switched off your microphone.
I'm sorry, because I'm on my phone and someone is calling. I'm really sorry. We justly advocated to the rights of... I'm sorry. I was talking about the cooperation with MAGO, yes? And
yes.
Yes. And you hear me about that, yes?
Yes.
The examination of the prisoners. Okay. I also want to mention that in Skopje is a home of the largest Roma municipality in Skopje, in which women from this municipality still do not have access of gynecology. This is a burning issue that has been debated over the years, but there is still no gynecologists in the territory of this municipality. The Ministry of Health does not mandate mandatory gynecologists in every municipality in Macedonia and do not mandate their distribution. This happened because the gynecologists should provide their services of their patient free of charge. And in a mutual agreement, all gynecologists in Macedonia charge extra from the patients. And that means that the gynecologists who will work on the municipality of Šuto-Rizari would not be able to charge of the services, considering that is the poor population. And nobody of the gynecologists does not work in Šuto-Rizari. We advocated for the rights of this woman and for provision of the medical services to improve the sexual and reproductive health in a variety of ways. And also in this presentation, I want to talk about a little bit our daily center for supporting of sex workers and their families, which from 2021 has been renamed to the Center for the Women of Social Risk, and is also expanding its activities with the women who use drugs, especially the women who use drugs because they don't yet receive the special center that can respond for their needs. Since HOPS, injecting equipment exchange centers, drop-in centers, have generally been for the people who use drugs, but because of the feeling of insecurity, attendance by women who use drugs is very low. That's why the center now aims to reach them by being a center specializing for the women where they can get a number of services under the one roof. We are talking about the services for a social worker, psychologist, a lawyer, medical person, which is dressing wounds from improper and long-term injection, hot meal, bath, wash and dry clothes, TV and computer, clothes and shoes, hygienic materials, educational workshops, etc. We are also collaborating with the medical services who are providing a therapy for the people who use drugs. And maybe near the center we will have opportunity to be very close with the new female center for getting medicals for women who use drugs. And that will be very good for us because the women who goes there can go to our center. Thank you for your attention, and if you have any question, I'm here.
Great, Ivana, thank you. There's so many things that you have. It's amazing. I think I will give a word now to another Ivana from Montenegro to tell about the services you have. And what was interesting for me that you have a hairdresser in your center for women, and that you have groups for mothers. Look, it's for parents, but as far as I know, mostly mothers attend those groups. Yeah.
Yeah. So thank you. As I mentioned at the beginning, I work in a drop-in center for people who use drugs, people who provide sex services, also in prison and with ex-prisoners. And we do also outreach work. So in our drop-in center, we have social workers, psychiatrists, psychologists, doctor, free legal advisor, also, as you mentioned, free hair dressing services, laundry and drying services, also support groups for youth that use drugs, and for people who live with hepatitis C, like a self-support group, and a lot of things. And always mention on our like team meetings that we had always problem to like with new clients, especially women, because in this environment very patriarchal and like closed, women are very shy to just come to us and told us that they're from community, for like the women who use drugs or provide sex services. So we always have trouble to get in contact with them, but like this like outreach work helped us, because we go to south and north, and we have like if we know someone from north, then that person can connect us with example woman that he or she knows that example use drugs or something. So on that way we can like connect and build that community and connect with those people. Now we work from 1996, so now we have that like people believe that our services are anonymous, and they can come here and just have a coffee and talk with us about things that like some situation then they want to solve, etc. So it was a long way, but now like we are trying to just build our capacities and like have additional services. And related to that, we noticed that a lot of women, our clients, have kids and families, and mostly are single mothers. So and that in this region we don't have services for them. So in 2019 we started the project a Healthy Family, Healthy Society, where we had like parallel workshops. One where a psychologist and social worker works with parents, mostly mothers, as you mentioned, and the other one is like teacher work with kids. So parents often have problem to like where they can leave kids for that hour or two. So we solve that problem with this idea that in the same time we have parallel workshops, and it works good. So till 2019 we have like few projects like continuation of this first one with that same idea. So in 2002 we have, and yes, that project and the second one that now I mentioned in 2022, it's for parents that are in risk of social exclusion or are social excluded. And this one in 2022, like we wanted, we noticed it at last project that workshops were like different days. So in this one we want to just make sure that every Thursday at 5 p.m. We have a workshop, and on that way we like make habit for that family, and like we have a great feedback from people that participants of workshop. And also we had a lot of activities like where we get together parents and kids, psychologists, social workers, and teacher, and then do together some things. And like every 5 or 6 workshops we have that like together time. And yeah, so also parents could we provide individual support from psychologists and social workers. So after workshop or before one, a person can come and just talk individually, consult with our team. So in 2023 now, we have with our partner organization, Psychological Association of Montenegro, our colleague is one of the first trainees for UNICEF program. So we noticed that we need more structure of topics and with more direct techniques and mechanism. So like we just get idea that we collaborate with our colleague who is one of first trainees from UNICEF program. And till now, I can say that participants of that program are very happy because they said that every workshop they have like concrete ways how to solve some situation and conflicts in families, and like they it helps them a lot. That they have that direct assistance what to do when things like that. So and this project is not just for people from that are risk of social exclusion, but for a whole community. So that is like a difference from previous projects.
Great, thank you. I think those services are unfortunately not that popular, especially addressing mothers with children. So it's a great example that you have it.
Yeah, and sorry, and in our drop-in center we have often situation where women comes with children, and also we have a few workers in shifts, so we can work with kids while women can like do hair or talk to psychologists, etc. And that happens often. So I'm always happy to see that they have that trust to just come with them, and that they feel like safe here. So it was always like,
yeah, I think it's often the problem that to come to the services, women need to choose if they where to leave the kids or to come and get the service. And it's great that you have a space for kids as well there.
yeah.
And next, I think I would give word to Alona from Moldova, because you have a really multidisciplinary center. You have a harm reduction center, and there you have also rooms for women in crisis situations.
Да, конечно, наша организация.
Yes, thank you indeed. Our organization that is called the Union for Equity and Health has been promoting harm reduction services in Moldova for over 20 years already. About 20% of our target groups are women, and today in Moldova, many centers do not accept as beneficiaries women using drugs or female commercial sex workers because of their very strict rules and requirements. And actually, women who face crisis situations cannot find a safe space because they are not accepted to such crisis centers. So that's why we decided to create a special safe room for women with children who are facing a crisis situation, who have lost their places of residence, accommodation, or have another challenges they face, and they need assistance. So the purpose of this shelter room, this safe room, primarily is, of course, ensuring the safety of the beneficiary and at the same time enabling them to get psychological help, legal advice. So actually, we provide an integrated case management, I would say. Also, we provide assistance related to harm reduction. And so this is a comprehensive set of services that are provided from such rooms. By the way, currently this safe room is located on or within our office, and we are planning to create a separate safe room in order to boost the safety and security of our center itself. Of course, different women have to stay for longer or shorter depending on the situation, but the longest duration of stay is 10 days. And as I mentioned before, over these 10 days, they also work and get services from different staff members in order to have their problems addressed or even solved.
I wanted to show the room that you were talking about.
Комната? Да, спасибо. Это вот вы видите, здесь это
Yes,
небольшая
thank you, Maria. Yes, indeed. This is a small room, and you can see the bed. We have a small cradle for infants, and well, actually, two women and one child, or one woman with 2 or 3 children, can stay in this room. So actually, opening of this room coincided with the start of the war in Ukraine. That's why our first beneficiaries were women from Ukraine, women with kids from Ukraine. And of course, we also worked with women who were facing violence, also domestic violence. And again, we tried to adapt to the needs of our beneficiaries. We also have a shower room. We have a laundry machine, dryer, and when the women stay in this room, a social worker stays overnight with her, just to ensure she has everything she might need.
There is a
Thank you.
question, Alena, if you can see it in the chat. What happens after 10 days?
Да.
What happens after 10
Да,
days
дней
that the woman
пребывания,
stay?
Ну, конечно же, если женщина не решает свой случай, она может...
So again, if the woman cannot solve her problem over these 10 days, of course, there is a chance that she might stay longer, because we know that cases differ. So that's why, of course, this is not a strict requirement to stay for 10 days sharp. Again, we are trying to use an individualized approach to the cases. And one more question. Do you do any work? Do you have any contacts with local authorities, be it the Ministry of Internal Affairs or police, or etc., especially if these are cases of violence? Well, it's actually up to the women to decide whether they want it or not. We cannot do it without her consent. We are trying to persuade the women to actually report the cases of violence, but they do not always agree. Sometimes after working with our specialist, women still prefer going back to their perpetrators. Of course, our team members work with these women. We have a paralegal, we have social workers who try to jointly offer a solution. Thank you.
Thank you.
Вот этот закон, закон по защите жертв
So
домашнего насилия, поэтому
in
многие
Moldova, we have the law on the protection of domestic violence victims, but again, it's up to the women. Some agree or some others refuse to report.
центр для одной женщины. Да, комната там может быть одна женщина, как я сказала. с
Yes,
несколькими-
responding to the question, yes, this is a small room, and it can fit either one woman with 2 or 3 children, or maybe 2 women with a single child each. So sometimes we had periods when, for instance, 2 women were staying in this room with their kids.
Нет, что касается употребления, у нас центр
And
не
now
имеет
the one more question is about the drug use. So there are no safe drug use rooms at our center.
такие.
So if necessary, we provide pharmacological treatment to women who might be facing withdrawal.
Если говорить о заместительной терапии, ну, насколько я понимаю,
And
новыми и
what
синтетическими
about substitution therapy?
не особо, так сказать, подходят. Здесь
So
вы
as far
какие-то
as I know, substitution therapy does not work well if people are using new synthetic drugs. So what do you do in this case?
в случае. Был заместительной терапии.
Frankly, we have not yet had such cases. We had one woman who was on the substitution therapy, but regarding synthetic substances, well, I don't know, really, it depends. And again, these women can get some help, but not in the context of our accommodation center, but maybe elsewhere from some harm reduction programs or units.
Yeah, Alona, there are a bit more questions about kids
Да.
in the chat. I will say that I will say it because people who listen to recording will not see the chat. So the question was that the women are still risking to go outside and use drugs and be caught by the police, and what happens with kids.
Если она на улице, что с детьми, ну это как...
So if she is in the street, what happens with her kids?
No, that the use is not allowed on the center premises, and then the woman can go out, can leave this room, right? So she can go out and use the substance outside and come back, right?
Да, 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 да.
Да.
Да. Но она
Yes. But she risks to be caught by police then. And what would happen with kids in this situation? Well, further, there are children's services if there is a decision to deprive her of parental rights or to give the child to the other parent, to the father, so that the father would be responsible.
если сама женщина без родителей, бездомная,
But
сама
if it's
родила,
just a woman, no other parent, no grandparents, so she just has a child, he comes to you, so you give her a bed for 10 days, you take care of her for this period of time. So in her in your center, in the shelter, she cannot, if she has a withdrawal, she cannot make an injection. So what she has to do, she has to go to the street, make the injection, and then go back. But police can catch her during this time, detain her, and her kids are with you. So what do you do with the kids? We are not the ones who decide. We can inform police, and the police would work with the children's services. We have um, um, center which was recently opened, so specifically for kids in these type of situations. And kids can stay there if they have some dysfunctional families, violence, or like in these situations that you described. So there is a special center for them. I see, I understand, but it's just a pity that you only have one room. Yes, we would like to expand. That is true. That is our goal. I cannot imagine because when I used to use drugs, I remember that I had 4 or 5 lady friends who also had kids, and I remember that we always supported each other, and we could stay at each other's place. Yeah, so it would be good if you had like 3 or 4 rooms at least. Yes, yes, that's true. Thank you.
Great, thank you. And we will speak now more about the spaces, safe spaces for women. And now I'll give the word to Christina from Kazakhstan.
Здравствуйте еще раз. Меня слышно?
Hello again. Can you hear me?
Yes.
So I will tell you a little bit about our organization. Our mission is to protect the rights and provide the legal support so that our clients would have access to services, reducing stigma and discrimination, and providing temporary accommodation and a shelter, and providing psychological support to our clients. Also, we do information campaigns to prevent violence and discrimination. We try to improve legal literacy, and our target groups are women living with HIV and their families, women who come out of prisons and places of detention, also women who use opioids and new psychoactive substances. Currently, our organization is implementing a project which is called Renaissance, and we started implementing this project in January 2023. So it has been almost a year, and this project is aimed at a re-socialization and integration of women from high-risk groups. So what we do, we provide integrated medical and social services under one roof. And we help women to resocialize, and we help to build a more healthy like social and atmosphere in the society. Also, we try to prevent children from being orphans. Now we have a house. A month and a half we moved to this new house. So our organization is 6 years already. It is we have moved on numerous occasions during this time, And this new house is a house of an important person from the Roma population, and we have big expectations from this new premises. We plan to open a social enterprise there so that women could work there after they are released from prisons and detention centers. Also, women who are in difficult life circumstances, they could get jobs, or if women would like uh, stop uh, to stop using street drugs, and she would like to have a source of income to meet her needs and get some money.
Деятельность проекта направлена
So the activities of our project are aimed at creating a safe space where women would be able to release this social and psychological pressure. It does not matter what group this woman represents. So, after places of detention or after drug use, it is important to release this tension. I go to places of detention myself, and I also spent 14 years in prison. Also, I have a big track record of drug use. So when I say, come and live in our center or in our shelter, so that triggers them, because I've been thinking about myself. If someone told me these words, I would say like, what is wrong with me? Am I homeless? Why should I go to your shelter or center? And they don't understand why it would be a good idea for them. So we try to explain. And we had this campaign dedicated to the World AIDS Day on December 1. I had to explain to these girls that I met that we are not the shelter or the center they are thinking of, because we are talking about, we have this kind of so-called beach centers. This is the terminology they are used to, but we are not the one. We explain that this is a safe space, and of course, we do have some rules. They are defined in the charter of our organization, and that we follow both ourselves and those women who stay here and who work here as well. And also project activities help women to uh, take back the social status that they have lost. So actually, we help to re-socialize in the society so that they will be able to communicate with other people, not being afraid of it. Because when people are released from places of detention, they are often afraid to talk to others. They are often afraid to go outside and meet people. They are just scared of all those things. And many people, they try to stay inside for a while, and women can stay in our shelter from 3 to 6 months usually. And first of all, we have this individual case by case approach. If a person becomes a part of our movement, part of our community, if the person shows themselves and is active and does what we do, because our main area of activities is doing this projects, and we do a lot of volunteering activities as well. So if the woman gets engaged in these volunteer activities and what we do, so we try to continue our further communication and interaction. Also, we try to provide all the necessary social and medical services or refer them to. So we help women to go to polyclinics and make appointments with the doctors. We do not always go there with people, but we make phone calls. We help to use the internet and make an appointment, etc. Also, we have lawyers who offer legal support if necessary, and also we help women in employment. So if they want to get jobs, so when women have this drug dependency, they of course have problems. It is often difficult for them to get employed. And here we work with multiple specialists, including lawyers also, or when they for example, sometimes they take loans, they don't give them back, so the lawyers help to address this. And we have a special chats where some part-time jobs are offered so that people can do some simple work and get paid. And we have also women with kids who stay in our shelter. So just yesterday, one lady came with two kids. One of the kids is 4 months old, and the other one is 13 years old. So she came to us because she is not able to pay for rent. So she is not able to rent a flat for her and her kids. And she already came to us when her baby was just 1 month old, and that's the second time when she comes. And also we help women to get a disability status if they need to. We help them to have their kids go to a kindergarten or to school, depending on the needs. So we try to provide comprehensive social, medical, and legal services to make sure that people can integrate in the society. So we also do some online workshops and trainings, and also in our organization we do different master classes. So we invite some specialists in different areas so that they would work with our women and help them to be psychologically prepared for being part of the society. And we also offer educational opportunities, as I mentioned before. For example, we have training courses for hairdressers and also massage specialists. This is what our women participate in. And we try to improve the quality of life of women with children by helping women to socialize and integrate and build connections with their families. So sometimes women come to us and their kids are in orphanages. So we try to help these women to find housing and address other needs, get a job, so that later she can take her kids back from the orphanage and stay with them. And also, we work with these women, and later we gave some papers to them, confirming that she is stable enough. But of course, before that, before issuing these papers, we have a psychologist talking to these women to do an assessment to make sure that she can take care of her kids, because her kids is not a toy. And also we provide, as I said, social support. We help women to reissue documents and get a registration. So that is a big problem. Without a registration at a certain address, you are not able to get any government services, like any benefits or social support. It is not possible to um, go to a doctor, etc. And also we have peer-to-peer counseling, which is very important, because when women come to us, first of all, they have a conversation with the peer consultant. Only later, psychologists work with those women, and then depending on the needs, there can be lawyers and other specialists. And as I said, we have this legal services and support, and also we have this legal literacy kind of sessions. We have a lawyer with whom we cooperate, and they come to our organization. And sometimes we organize online sessions with our lawyer and with our psychologists. So we define a certain topic which would be interesting to our women, and we have this online discussion. And if necessary, also we invite our psychologist to come to our, say, shelter to talk to women individually. Because when people come to our house, they feel this atmosphere. People do feel at home. We try to make them feel really comfortable. Uh, and when we come back home, we feel how our family feels. What is the atmosphere? The same happens here. We feel the atmosphere, and we feel if there is some tension among our beneficiaries. So if we do feel this tension, we try to address this problem ourselves. If we cannot do it ourselves, then we invite some professionals to talk to our women. Sometimes they have individual conversations with them if needed, or sometimes we organize some group sessions as well, because maybe someone had a nervous breakdown and it led to some problems, because some women come after using psychoactive substances, and they do have this mental health issues. So we try to prevent such big breakdowns. Of course, we cannot control, like if she goes outside and she can get some substances she can use, but we try not to let it happen, not to have conflict situations, because we know how it all works.
Диагностика, обследование личности, ну, как я и говорила.
Also, we have these services of diagnostics. We provide psychological support. We do a lot of psychological prevention activities. So we talk to the beneficiaries in groups, also individually. And most of you would understand that you can actually understand a person's mood judging from her behavior, from her posture, facial expressions. So sometimes the beneficiaries who come to us are facing a nervous breakdown and they do need psychological counseling. And also we have a peer support group. We on our premises, we arrange for the meetings of the peer support group. We invite beneficiaries who live in the neighborhood, and we try to break this cycle of isolation from the external world for these women. We also try to provide them assistance with finding a job. We provide computer literacy trainings. We help them get access to disability allowances, etc. We help them with the documents. And
Christina,
also,
thank you so much. I'm afraid we don't have much time and we have more people to talk. And you have like a really comprehensive service and you have so many things that you listed. I'm sure there's more. And maybe if like we can share the contacts and people, if they're interested, they can learn from you. The next word I would like to give to Neva and her colleague, I don't know the name, from Slovenia. They have a house for women as well.
Hello. I'd like to apologize for being late, but hello to all. And I'm sorry that we didn't understand a lot what the colleague had said already, and I hope it will be translated somehow and somewhere.
Neva, there is a translation available there. It's the globe downside. You need to press on it and you can select English channel.
Okay. Okay, thank you. Okay. Then,
can you hear the interpretation now?
About our house. We are not a shelter, we are a safe house. We are open 24/7, and because we are very, very important for our women, because there is much violence on the streets, and women who use drugs are almost have big problem with homelessness, and they are how can I say, there are also lack of gender sensitive programs, which also causes violence. For example, last year, Tamara had made research about these shelters for women, which are not specialized for gender specialized, and maybe she will tell you more about. So yeah, last year we did a research here in a safe house with women who already have experience with shelters for homeless people. The problem is we only have mixed shelters, but there are more than 90% of male users there, and that for sure doesn't mean that there are only few homeless women. The real problem is that social welfare programs don't meet women's needs. This is well known as hidden homelessness of women. So we did an interview with 13 women who had experience with shelters. All of them report different kinds of violence, like harassment and sexual violence. So research showed we absolutely need a separate shelter for women active drug users. And of course, this is far from perfect way of housing, but some women can't follow the rules in our safe house because they are too much on the scene, and they need even lower threshold. So yeah, this is about shelters, but overall we need more social welfare programs which meet women's needs, like harm reduction programs for women in prostitution. Women who use drugs, as we know, are the most vulnerable to violence among sex workers. And the other thing, we also need harm reduction programs for pregnant women, active drug users, and they are unfortunately known in Slovenia. So if we observe carefully, we see that our social welfare programs mostly meet the needs of men, but they see themselves as universal, and that's the big problem. There's a lack of gender-sensitive knowledge. Yeah, that's maybe about needs and.
Yeah, but tell more a bit about your center, your safe house.
Okay. Yeah. So yeah, this is the only safe house for addicted women in Slovenia, the only harm reduction safe house. So it's low threshold harm reduction 24/7 program, and staff members are always there. So abstinence is not required for entering the safe house. So first of all, we offer them safe space, support and acceptance. We offer them counseling, advocacy, escort to institutions, management of social issues like managing their social financial aid, getting their ID, I don't know, health insurance. We offer them needles and syringes exchange. Yeah, we also have 2 daily centers, and once a week we offer counseling in a prison, the only prison in women's prison in Slovenia. And maybe the problem there is also we don't have harm reduction program there. In prison. In prison, they don't have access to needle exchange. So that's a big problem.
Yes, and we also have three flats. After a safe house, the women who are stable should go there and have her own room, and they could stay there until some better solution is found. So, but in the house we are working also in the way of getting good relationships, be accepted, and they could become knowledge how to communicate with people, how to get in better relationships between each other, and so on. And I think they also feel here like at home, or maybe they learn something that should need in later experiences in their own. So yeah, we qualify them for, I don't know, for independent life, for empowerment, and to live less risky. Yeah, that's about the safe part. Maybe something about violence. Our users have long history of violence, of course.
Trauma.
Yeah, mostly they were highly traumatized in their childhood from their significant others, and their childhood
trauma is also present in their later in their life. So we understand their drug abuse as a coping mechanism. So it's the way they deal with the pain. And later on, they are exposed to high levels of violence with their intimate partners, on the streets, in health institutions, police departments, everywhere, in centers of social work and other social services. So they are highly stigmatized as we know, bad mothers, addicts, delinquents, prostitutes, wrong women in patriarchal society. So in those professional services, they are looking for help, but instead they are often re-traumatized. So as we see, women who use drugs are one of the most stigmatized, marginalized, and most discriminated groups of women. Yeah.
Yeah. Thank you, Neva. You have a great house there. I had a chance to visit it. And now I will give the word to Yelena. Wait, I'm trying to see if she's here. Yelena from Croatia.
Hello.
Yeah, yes, you're here. Okay, I found you on the screen. Great. As far as I understand, you have rehabilitation services for women, or correct me if I'm wrong.
Yeah, in this moment now we have mixed center for male and female users of any kind of addiction. First of all, once again, hello to everyone. My name is Jelena and I'm working in Zajednica Susret, which is NGO from Croatia, which is working from 1990s. So now we have two centers, two counseling centers in two parts of country, and we have two therapeutic centers, which is one is the mixed center that I mentioned in the beginning. In this moment, we have this mixed center, which is important because there are people, it is therapeutic community, so there are people who are in the treatment. But at the same time, as we have a gender approach to our beneficiaries, which means in sense, if they are also in the same building, but it is physically separated building, because physical and psychological safety as well as trust in relationship is most important for recovery of our clients. So we are ensuring a safe space for the women. They are in separated buildings, but connected also. We employ employees of both sexes. We have 21 employees and 13 of them are women, so that everybody have the staff that they want to work with them on the recovery process. We also have staff who is specialized in working with victims of violence and trauma. And what is the most important thing, we have a strong networking with the local community and external experts like public health system, psychiatrists, gynecologists, doctors, and other external experts that we can have an integrated approach to our clients. As I said, we have some adapted interventions and educations which are specialized for the women's. So we have psychoeducation about the pregnancy, parental roles, sexuality, blood and sexually transmitted diseases, and reproductive health. We also have specialized therapy groups for women victims of abuse, discrimination, and other types of violence. Also, we have mixed therapy groups, which are focused on male and female relationships, with a focus on interpersonal relationships, where women can express their fears and problems. Also, what is important, we have a special therapy groups for men that help men, where the focus is on exploring patterns of abuse in past and present relationships, whether they are in the role of abuser or a victim. Also, our goal is to empower women in assuming social roles which are reflected in the structure of roles and responsibilities that the beneficiaries assume during the treatment. And we have individual work with a trauma specialist. So there are like a few points which are most important in the recovery process according to gender perspective. And this is work on trauma and emotional supports, also prevention of relapse, education about the health and the reproductive system, and also special checkups. There is also important thing to work on motherhood and family relationships, because we need to support mothers in the recovery process. Also includes a program to reconnect children with families, because I also heard from colleagues here that you have a lot of problems with women who use drugs, and they are also mothers and they have children. I will tell you more a little bit later about this, because for us now this is the challenge. As I also said, we are providing psychological and emotional support for them, individual and a group, and there are also peer groups. And we are working on education and self-confidence to empower women. One of the most important things and the projects that we did, which are the most relevant to this topic, is Interlive project. So last year we took part in the project, and the aim of the project was to do an intervention toolkit to deal with women drug users, victims of gender-based violence, which we did with 6 countries in Europe. So also this toolkit is for the professionals who are working with women who use drugs and who are also the victims of gender-based violence. And we did this toolkit. If you are interested in this, I can send you the link for toolkit, so you can use it also. It's free for download, and it is also a live document. So we are still working on this. We are taking suggestions from other, if you have some suggestions what to change, what to add. Because we want to improve this toolkit and also to share it between all our colleagues who are working with women who are using drugs and they are also victims of violence. Also, as I said before, and for us, it's a challenge to open the center for mothers and children, especially for the mothers who are using drugs or they have any kind of the addiction, because now in this moment in Croatia there is no existing place for the women who are victims of violence, and at the same time they are using drugs, because the safe houses that are existing, they don't want to accept them. So the next challenge for us and the next year is the opening of this center. We started the registration process. I hope that next year we will open it. And also, as colleagues mentioned before, we have a lot of problems. What will happen with the children if if they cannot be with them? They are going in social welfare system, and after it's really hard to reconnect them with the families. So idea is to open center where children can be with them, with of course monitoring of specialized staff who will work at the same time with the children who are also victims of violence, any kind of, because they saw a lot of things with their mothers who are unfortunately are using drugs. So this is the idea for new integrated process and the service that we will provide. So thank you. If you have any questions, I can send you the link for this Interlive toolkit. And also in the same project, we did research in 6 countries in Europe because of the lack of services for the women who are using drugs, and they are also victims of gender-based violence.
Great, thank you, Elena. And if anyone from you have materials to share with other with others, please send it to me and then I will forward it to everyone who registered for the meeting and to our members as well. And I think Evna can do the same with their members. We're done with the official list of speakers, but I know that there are people, for example, Nargis, who asked many questions. Nargis is from Tajikistan, and I know that there they also have, it's not a center, but it's a separate space for women on the basis of harm reduction, a center that they have separate entrance and beds and some special safe spaces for women. I'm not sure if people can stay there, but I know that you do have it. Also, there is Maria. Maria worked in Russia. Maria, if I'm not mistaken, you were working in EVA organization, and I know that you worked a lot with pregnant women who use drugs and access to services for them. Maybe any of you want to share, and I see Ina Saran also joined us, and I know that Andrei Zhulkov Foundation also made some special training manual for their social workers, how to talk with women about violence, how to start this conversation. If any of you would like to tell about what you have or any other people, or you have questions, please raise your hand.
Да, меня зовут Мария Гордевская.
My name is Maria Godlevskaya. I used to work in EVA network. It's the first Russian network that was created to support women living with HIV and women at high risk. And I think that the most interesting example of our program was this spent school. So actually it was to counter economic violence, school to counter economic violence, because we know that many women, they are not able to leave the aggressor due to economic factors, because they are economically dependent on other people, especially if they have a kid or several kids. And our task was to create a training module where we would talk to women about how to make their budget, because people are not just born with this knowledge. Also, how to deal with the debt, because we have a lot of credit companies where you take a small, tiny amount of money, and if you don't give this money back in a month, your debt is growing in like really quickly, and you have to, give back a big amount of money. So if you just take this small amount of money to buy diapers, then you are in debt, and the amount is growing. So we were discussing the legal issues, how to recognize that you're bankrupt in some situation, also how to build your budget, and how to prioritize monthly payments, how you can save money for some bigger things, and also what kind of social benefits you can get from the state, some uh, social benefits, children's benefits, etc. Also, how you can make sure that your partner makes this children's payment, and if he does not do that, what kind of problems you can create for him, for example, that he would not be able to get a driving license. So we worked with experts, and we were building this financial literacy to so that women would learn. First of all, we engaged active women from the EVA Foundation, and in our school, we had kind of TOT for these women. So first of all, we trained them so that later they would educate and train other women in their community, so women who use drugs, women living with HIV, women in the situations of violence. And I think that it was a really helpful program because if women are able to at least resolve these financial issues, they are able to address other things, their sexual lives, their health situation, etc. That's all I wanted to share. Thanks.
Great, thank you, Maria. Anyone else want to ask questions, add something, tell about your services? Or what you would like to do, but don't know how to start it? Okay, if no one has anything to add, I would like just to thank you all for coming and for sharing your experiences.
Подожди, Мать, пожалуйста.
Лена, yes,
Да, вопрос же у меня был, я написала.
I had a question about this a safe house in Slovenia. So it's a low threshold. It's easier for women to get there, but there are still some requirements, right? So I'm really interested in this experience. So colleagues, could you please tell what are the criteria for women to be able to access this safe house?
To access is easy, but after, you know, there is some structure in the house, some rules, because this is the here is home for many women, so they have to respect those rules, because otherwise the life wouldn't be nice and good for everyone. So they should not using drugs in the house, because we don't have the legislation which allow this. So there are some such rules, house rules, and we should respect them all. So coming in the house is easy, but after then the women decide if they could manage those rules, and if not, if this is too hard for them, they should go out. And that's the problem then with shelter, which is not it doesn't exist in Slovenia, the shelter who women could only sleep over the night and in the morning go out. And so
but you provide harm reduction services. I mean, you provide clean needles and syringes, but you don't allow use. So people can go out, use, and come back to the house.
Yes, that's possible, of course, but only in the house it's not possible because of the legislation. And now we already have the first safe room after in January 24 next year, but not in Ljubljana, in Nova Gorica. It's the west part of Slovenia, and we are happy to hear that it's possible now somehow.
Yeah, maybe it will extend to Ljubljana as well.
Yeah.
But I know that in Slovenia there are shelters, but they accept people who use drugs, but they're not separate for women. So that's
It's only one shelter like this, I think, or maybe two in Nova Gorica also, but the places are not separated. Yes, now they are building in Ljubljana a new shelter, but it will be the building will begin in 24 and end about in year 27. So it's long time till there. So.
Lena, did it answer your question about the rules?
Да, спасибо большое.
Yes, thank you.
Great. So then we don't have any more time, unfortunately. I would love to have a whole day and discuss all the issues because I think not all the issues have been covered and there are more things to share, and maybe we'll continue our dialogue somewhere else and hopefully offline, not online. Thanks to our translators, Anna and Victoria, to help us understand each other. And so please share the materials if you have any, just send them to me and I will send it with everybody. And have a nice day.
Thank you.
Goodbye.
Bye.
Всем хорошего дня, до свидания.